Hey guys, welcome back to Skin Anarchy. Today's episode is going to be very focused on aesthetics. We're going to be learning from the best of the best. I'm so honored to be hosting our guest today. Many of you might recognize her from Dr. 90210, and so would love to go into her background. She is a board certified Ivy League trained plastic surgeon and the founder of Perk Plastic Surgery in Beverly Hills. So without further ado, please welcome Dr. Michelle Lee. Welcome, Dr. Lee. I'm so excited to host you.
Thank you so much. So excited to be here.
Yeah, I can't wait to dive in. And Dr. Lee, I always start medical focused interviews off by asking physicians, like, what really got you into medicine and when was that moment in your life where you realized, like, I'm gonna go this route and I'm gonna commit to it? If you could kind of walk us down memory lane.
Sure, absolutely. I never thought I was going to be a doctor. I'm just going to come out and say that as a human being, I was always told that I've always been obsessed with aesthetics and beauty ever since anyone has known me. So the story that my parents love to tell is that I was 3 years old and I loved this pair of shoes and it was so pretty. And I'm three. Like I just know that this is a really beautiful pair of shoes. It gave me blisters everywhere, but I refused to take it off because it was so pretty. So as long as as long as I can remember, I've always been so obsessed with beauty and aesthetics. And it's not just so much physical aesthetics, but everything like, beauty in music, beauty in landscapes, furniture, fashion, or whatever. So that actually led me to be a piano performance major in
Oh,
college. Yeah, so I really thought I was going to just be in this artistic world. I graduated from UCLA, and my parents were like, "We're so proud of you. Great job. We're going to like not fund you anymore. So good
oh.
luck being a piano major." And all of a sudden, it was kind of like a screeching halt. The reality hit. Like, how am I going to make this work? It's very challenging to be an artist, and I have so much respect for people who make it and can pursue art
Yeah,
as a living.
yeah.
So I thought to myself, it's very expensive to live in Los Angeles without any source of income. So I thought, you know what, I need to do something practical. And coming from, an immigrant family, the practical job that always paid reasonably well, medicine is one of them. So I was like, you
Right.
know what, I need to do something stable. So I hard pivoted left. And, it's not a very, aspirational story, but I was like, you know what, I need something practical. I need to be a doctor. And so I
Yeah.
applied to medical school and I got in. I went to University of Pennsylvania for medicine, but this love for beauty has always just been inside of me. I was really never drawn to the traditional aspects of medicine, such as cardiology or whatnot. I was immediately drawn to plastic surgery and dermatology because it's the most it combines aesthetics and science. So I fell in love with plastics, and then from there on, I think I found myself the perfect field.
Yeah, no, I love that story. Thank you for like sharing that because I feel like nobody talks about that. Like enough doctors don't discuss like our other passions and like other things we did in life. Like I feel like every time I hear the story of how someone came into medicine, it's like, well, I just love science, and I wanted to go into science and it's like I get that. I was definitely in that boat, but I really love that you had this like, other stuff that you're focused on, you appreciated beauty because that is such a huge player. I feel like, especially right now, the way as a consumer, and when I'm looking out into the space, a lot of the times, I think a lot of it is very like anatomy led, in terms of like the plastic surgery component and aesthetics and everything. And everybody's so hyper focused on like, what can we do to like modify ourselves? And no one discusses like what does beauty actually mean, whether that's psychosocial, whether that's, whatever that might be. We don't discuss it at large for some reason. And it really bothers me, when I see that. So that's actually my first question for you is this idea of like, when you think about the world of aesthetics, the world of plastic surgery, dermatology, any of these fields that are so, intersecting with how we view ourselves, what do you think is the most important thing for consumers to understand, for patients to understand, before even approaching any kind of thing, right? Even skincare or topical solutions.
I want to back up a little bit. I'm so glad you mentioned that because this is a thing that I obsess about all the time.
Yeah.
So, for example, like right now, everyone's obsessed about jaw lines, right? But when
Hmm.
I look at someone's face and they may have a perfectly smooth, perfectly sharp jawline, but then when you look at it, sometimes you look at the person, it's like, but is that aesthetically pleasing? Like, do you want to have a jawline so sharp that it can, open a can or whatever.
Yeah.
But it doesn't always translate to being beautiful, right? And I think beauty is so much more than being wrinkle free or having no pores or have a perfectly smooth skin. There's an X factor to it, right? And there's some people, I'm sure you've met many of them, that they have wrinkles and they don't have perfect skin and they just radiate this beauty, and we don't 100% know what it is, because beauty is about harmony, proportions, and inner radiance, right? So I think right now, it's a challenge for the aesthetics field, because you have to say, like, well, if you have hyper focus on one thing, like, I want to reduce wrinkles, I want the skin to be pigment free, or all my pores to be poreless, glass skin. When you get so hyper focused on one thing, sometimes that's a very slippery slope and a very dangerous slope, because then you don't look human. Um, I've seen, I mean, there are people with flawless skin, but then they just look, it's too flawless. You look like you're waxy and glassy. And that's what happens when you have too much of a good thing. And I often see, like, there's so much information out here right now. And I often see patients who come in and they're just like, there's something about it that just doesn't look right. Does that make sense?
Yeah. Yeah, absolutely. And I'm so glad you said that because body dysmorphia is also a real thing. I think nobody discusses that at all. Like it's not even about like and you know what's crazy is like I feel like when we bring up the term body dysmorphia, everybody freaks out. And it's like you're calling me anorexic, you're calling me bulimic,
Mhm.
and it's like no, it's a real conversation. I'm pretty sure I went through it many, many,
Yeah,
many times in my own life. So it's like I love that you are pointing this out because I think sometimes we just have to check ourselves and be like, I'm looking in the mirror and seeing something. Now, I need to go
yeah,
to somebody who's a professional that is going to actually give me a pragmatic view of this. I'm not saying like I'm sure like you don't, when a patient comes to you, you're not going to automatically just be like, yeah, okay, I'm going to do it. You have consultation with them, you discuss things with them. And I feel like that's what I think consumers, we want to jump that. We want to jump over the fence with that instead of just relying on our professionals to be like, let's have a conversation and let's open this up and like pry it open and figure out what is it that's bothering you at the end of the day? So I would love for you to speak on that a little bit in terms of like where do you think that checks and balances needs to begin for people? Like, do you think it begins in the clinician's office, or do you think we can do things before we even go to a doctor, about this?
I think the primary responsibility first lies in the clinician, whichever provider is treating the patient. It is your responsibility to say no when you don't see, and be able to identify BDD. And it's so important. I often find that some of my most beautiful patients are the most self-critical, and they point out something to me and I'm like, I don't even see what you're talking about. you know
Yeah. Yeah.
and and we say no all the time, and that's so important, because everyone has a tendency to fixate on something that they dislike, and then your algorithm all of a sudden populates you with the procedure or the skincare cream that you absolutely need to fix that one thing. And I think media companies, like, and social media platforms, also has a responsibility not to create BDD and unrealistic images for the population. But the primary responsibility is the person who's providing the treatment. In aesthetics, it's a tricky field. I love this field, but
Mhm.
it's ripe with misinformation. It's ripe with people who can really take advantage of the consumer, because there's a lot of money in it.
Yeah. Yeah. No, that's very, very true. And I agree. And what really bothers me is that I don't know, for some reason the last few years we've diverged from this idea of, because when I was growing up, I'll just use that as an example. When I was growing up, it was a norm. You went to a board certified specialist in a field, whether that was endocrinology, whether it was dermatology, whatever. We didn't go to like hole in the wall practices that popped up, you know what I mean? Asking for a prescription for whatever, like, whatever we needed. And nowadays, I feel like in the last few years, we've kind of seen this culture shift where people are now relying on people that don't have the credentials. They can't guide you. And so I know what you mean about that, where it's like it's on the clinicians, but I also feel so bad sometimes because in the field of aesthetics, I feel like there's so much critique here because
Mhm.
doctors simply can't control sometimes who you went to first. Like somebody might have got, like you were talking about jawlines earlier, right? Like if somebody goes to like a whack job somewhere, right, who has no credentials and they're being told this, like it's being reinforced in their mind, and then they come to your office, you're going to be like, what are you talking about? Like from my medical expertise, I'm not seeing what you're talking. And so I think that's also a big thing that I see a lot from, just having this podcast and seeing the industry now, like that people are falling for these like pseudoscience explanations, whether it's on social media, whether it's like, non-credentialed individuals, and then they're holding the aesthetic community responsible for the spread of body dysmorphia. And I just simply disagree with that, where it's like, I don't think that's really what it is. So,
And I think what's also interesting is that, everyone wants a simple answer, right? So
yeah.
right now we're seeing a shift saying all filler is bad. You get one drop of filler, you've ruined your face forever. Let's all go to biostimulation. But then in reality, biostimulation is not the same as regeneration, right? So when you think about things that's biostimulatory, it creates a lot of fibrosis. Regeneration is actually replacing like with like. So
Mhm.
you see the same amount of problems with biostimulatory. So when I'm doing facelifts, when we open up all the planes of the face, I've seen scarred in planes from biosimulation, from fillers, from threads, from energy-based devices, all kinds of crazy things. It's kind of like I don't know what to see. So then, like, whenever I talk to someone about a facelift, I list like this laundry list of, have you had this, and they think I'm trying to quiz them, but because you never know what you're going to find in surgery. But the interesting part is that sometimes when you have a bad surgery, that creates more scar tissue than anything you've talked about before.
Yeah.
So, this field kind of has this yo-yo effect where it's like, oh, filler is bad. Let's go to biostimulation. But I've also seen really bad biostimulation. Then, oh, let's all get a facelift when you're 30. But you can't have an unlimited number of facelifts. That creates scar tissue too. So you have to be very nuanced. And, people don't like to say like, you can use this for this, this for this, this for this. So it's important for us to educate the public about this
No, I completely
and not
agree.
simplify everything.
Yeah, exactly. You can't simplify everything. And just to like, build on your point, I would love to ha get your opinion here is this idea of like, I talk a lot about skincare on this podcast. And one of the big
Right.
concerns with anybody using skincare, people usually use skincare when they have like texture issues, for example, or like, hydration or like the overall tone of their skin. And I'd love for you to kind of dive into this with us in terms of like, what is that line between what we can do with skincare and then when you should actually be considering an aesthetic procedure for something like texture?
Okay.
Yeah.
So I think for skincare is the basis of everything. So whenever I get really excited about a facelift is because the patient has great bone structure and great skin. So I know, wow, this is a great canvas that I get to work with. Whenever someone has, thin skin, I'm always a little bit hesitant because I don't know how good of a result you're going to get just because you don't have the skin quality to support it. So when I think about skincare, you have to have the basis. You clean your face every single day. Make sure you wash away the day. You're using sun protection, whichever, the whole thing about sunscreen is toxic just drives me insane.
Yeah.
Um, and if you have texture issues, it really depends on what exactly is the texture issue. Do you need some kind of retinoids to help the skin to turn over or some kind of exfoliation? And you have to have a consistent routine, but consistent routine. And then you have skincare procedures in a dermatology or plastic surgeon's office to kind of boost that. But
Mhm.
you can't just do a procedure and expect that to be miracles without the baseline skincare every single day.
Yeah, no, that makes a lot of sense. And, I'm glad you brought up retinoids because I think that's a hot topic right now, retinoids and understanding like what they can realistically do for your skin because I've seen all sorts of stuff online, and I would love to kind of debunk this a little bit with you where it's like retinoids, I know they do so much for the architecture of our skin, like if you're consistent with them, if you're sticking to them. But then like if say you're like in your 40s, right? And you've been relatively consistent with your retinoids. What are some like aesthetic procedures that you think would be, I mean, I know this is individual, but just to give a little bit of generalized, nature to this, what are some aesthetic procedures people could think about, if they're reaching that 40, 50-year mark and they're like, hey, I've been doing my skincare, but I don't know, I might want to get something. And is there anything that you kind of go to immediately in your mind when someone approaches you like that?
So this is very boring, but
Mhm.
I love good old microneedling, not
Yeah.
radio frequency microneedling, but just the needles vibrating. And there's very good science that backs this up. They show that after you've had microneedling after 5 or 6 times and they biopsy the skin collagen thickness increases by over 400%. And this is well documented. I actually love broadband light, BBL, not Brazilian butt lift, but broadband light.
Yeah, I'm glad
And,
you clarified.
um,
Yeah.
um, broadband light basically helps even skin tone with browns and reds, and it improves skin texture. And there are studies coming out of Stanford that basically show that people whose skin has been treated with BBL over 10 years behave younger than if they've never had a treatment before. They looked at before and afters 10 years apart and they thought that was a before and after of before the treatment. So there are very well documented studies. So there's so much devices that come out all the time that claims it does this and this and this and this. But I think supporting skin's health from microneedling causing controlled stress to the skin so it can regenerate and create collagen is very good.
Yeah, that makes sense. I mean, I've heard great things about microneedling. I've always been too scared to do microneedling, but I've heard such great things. So I'm actually gonna look into it more now that you've mentioned that because yeah, it's not boring to be honest. I'm glad you said that because I think sometimes we're expecting this like incredible like the newest technique, the newest device that just came out. We're always expecting practitioners to tell us about that, but it's just like we can't always rely on that. That's not. But is there anything right now that you're really interested in? Like, are there any devices or new techniques that have come to market that you're like, I like this. There's a lot of promise here?
I'm someone who I'm always suspicious of new devices at
Hmm.
all times
Yeah.
because I think it takes time for you to see what's going on and what's the long-term effect. Everyone wants to see an immediate before and after, an amazing transformation, but I really think about aesthetics in the long term. What is this going to do in 10 years, in 20 years? And we're seeing this with radio frequency microneedling. When that came out, it was the hottest, greatest thing. It's jazzed up microneedling. It's radio frequency and microneedling. It tightens, it lifts, it's all of the things.
Yeah.
And then now, 5 years later, you're seeing, oh, it's melting the fat in your face. You need to preserve all of the fat in your face so you don't get a worse skin quality. We see so many patients who come in and say, you know what, I did radio frequency microneedling and my skin is now crepey. It looks far worse because it melted all the fat underneath. So you have this thin, crepey skin, and you can't really go back on that. So I like things with long-term data that is like, I know what this is going to do now, what is going to do in 5 years, in 10 years. There's no question because I don't want to do something and say like, oh, it looked great right now, but 10 years down the line, this is, you only have one face,
Yeah.
like if you want to think in the long term. You don't want to think like, hey, I want to do this right now. Like skincare, when there's so many things and like aesthetics, there's so many things, but when you really boil it down to, there's only a couple of things. It's not that fun and that sexy and all the newest and greatest things. I know everyone's talking about Zerf right now. And everyone's like, it's painless. There's no downtime. Great. Like, but I want to wait until I see the long-term data before recommending it to my patients. Maybe that makes me very boring and conservative.
No, I think you're playing the smart long-term game, like you said, because that's really what I mean, I want that from my physician. It's like I don't want to be recommended things that there isn't robust data around. That's actually why I brought retinoids up to you and from the skincare side, because people love talking crap about retinoids, but it's like that's the most studied
Yeah.
skincare, even though it's a drug, that's the most studied. Like you can't refute the evidence. So I completely hear you, and I love that you're so focused on what's tried and true and proven to work. And speaking of, I want to actually ask you about like skin laxity issues because I know we're seeing that a lot lately. A lot of people are on GLP-1s. I'm sure you see it a lot in your practice. What are things that actually work for skin laxity versus maybe some of the hype that you've seen like on social media or, maybe even heard from your patients?
So, I personally really love SoftWave. I'm not affiliated. I mean, we have a SoftWave device, but the company doesn't pay me for anything for this
Yeah.
reason. SoftWave is ultrasound, and it stimulates the skin to produce collagen and elastin. And I do see that it helps with skin elasticity. That's in the same category as alt therapy, but it really depends on how deep the alt therapy is going. When I really think about laxity, we have to really back up and say like, why do you have laxity, right? As
Mhm.
we get older, we're going to lose collagen and elastin. When you're in your, for a woman, when you're in the perimenopause era, you lose 30% of your collagen within the first 5 years of perimenopause or menopause. So you really have to find the root cause. If you're just trying to address laxity, but really what you need hormone replacement therapy with a device, that's never going to work. So you really have to look at what is it that's causing the laxity. And genetics also plays a huge role. Everyone knows that grandma who looks like she's 50 years old and only washes her face with soap. She has
Yeah.
no laxity because she has great genes. She stays out of
Right.
the sun. So
Yeah, yeah. No, that makes a lot of sense. And I know I actually had a grandmother like that. I still think about her and I was like, wow, she was looking damn good for 90 years old, like yeah, I know what you mean with the genetics part, and I think this also feeds into one of the questions I had for you was this idea of like longevity aesthetics keeps coming up now. I
yeah,
think more than ever. I love longevity medicine. I think there's a lot of potential there. Myself, I'm very interested on the research side, the regenerative medicine side of it, but I would love to get your take on longevity aesthetics. Like, what do you think that actually means in terms of like whether that's procedures, whether it's mindset. I mean, what's your take on longevity in general?
both. So, for the mindset part is that I hope that every single patient evaluates all the procedures that comes up and all the things that they get bombarded with, saying like, hey, like what I just said, how is this gonna affect my face 10 years from now? Am I gonna look lumpy bumpy, or am I gonna look youthful in 10 years? And the goal is not to look youthful, but just to look, refreshed and like yourself, or am I just gonna look like I'm done and everything just looks a little bit off, because the human brain, the human eye can catch millimeter differences. Sometimes when I go to these aesthetics meetings, I look around and I'm just like, everyone just looks like they're a little bit done, but no one looks quite right.
Yeah, yeah,
Of the practitioners. And I'm so horrified of that in many ways. Now, regeneration, that's the holy grail. We've been chasing this fountain of youth regeneration since, I don't know, the beginning of time. Like, when you look in history books, people are looking for the fountain of youth. I personally, as a surgeon, I'm the most excited about fat.
yeah.
Fat is unbelievable. And this is the part where the science hasn't quite caught up. Like, we don't really know how fat is doing this. So we've been fat grafting people's faces for decades now. And then we're seeing a change on the skin from the fat grafting. Wherever you're fat grafting, you're seeing skin changes. So this was seen in breast reconstruction that has nothing to do with facial aesthetics. So
Mm,
people who've had mastectomies for breast cancer and radiation, when you fat graft the area to give you more tissue thickness, there's something the fat is doing to the overlying skin that's reversing the radiation damage. And we don't know how it's doing that right now.
wow.
So the same thing is happening with facial skin, that the fat somehow is rejuvenating the skin. And I think this is the frontier of where we're going to go. It's like, how is the fat doing it? Is it the macro fat? Is it the nano fat? Is it the growth factors and stromal fraction from the fat that's doing this? I really love a nano fat rejuvenation of the skin, where we break down the fat to just the stromal fraction and the growth factors and all the goodies and get stamped into the skin. I just want to be super honest. I don't 100% know how it's doing this.
Yeah.
I think, I need the biologist to tell me, but the skin looks youthful. And there's data that's been tracked, 10, 20 years, how fat grafting just somehow is regenerating the skin.
Wow. Yeah, I'm so glad you brought up fat because I've always been intrigued, like from the research side, about the PPAR gamma pathway because I feel like it's one of the most like understudied pathways in skin rejuvenation. Like I know we know a lot about it from just like hard science, like learning about it in terms of like differentiation of fat cells, but I feel like there's a huge like, and this is one of the topics I feel like longevity can really hit on. And I'm glad you're talking about this because if there's any longevity physicians in the audience, we need to dig into these pathways because some of them are such like upstream targets that we don't know
Mhm.
what's going on. Like we saw that with like mTOR. I feel like mTOR was one of them, right? Where everybody was like really excited about mTOR inhibitors and longevity. And it's like, yeah, because it's like one of the biggest anti-inflammatory pathways. And so we don't know what that's going to do when you actually tweak it a little bit and what that means downstream. And so I think that's huge. I mean, it's really interesting to hear that you see such instant results and you're seeing that over time result as well, where it's like signaling combined with aesthetics. I mean, that's the holy grail, I feel like, that you can expect. So,
Yes, and I'm excited to see how we incorporate that. Like I don't think everyone wants just to go to the surgery and, harvest fat from one area and put it in another area, but we have to really see like how is the body regenerating this? Because I think the main thing is that regeneration is not fibrosis. And right now, all the things that we're doing is creating fibrosis and not true regeneration.
That's right. That's right. No, I want to ask you, you had mentioned like, you can always kind of tell when someone's done. And that's a really powerful statement in a good way for me to hear that because I've always felt that way. I'm like, is something wrong with me? Like I just like clock people's faces. Like I'm just like always like, but I really feel like it's a conversation to have, you know what I mean? In terms of what do you think it is, or like where do you think that line is where someone gets work done and then you can tell, somebody else can tell that you had work done versus like small incremental changes that you might want to opt in for, from the aesthetic side. What do you think that balance is before it becomes very obvious,
I think um, when work can be detected,
Mhm.
there's a disharmony because everything should go together. And then the human eye is very good at detecting. So, for example, if your jawline's super, super snatched or, tight, but then your skin quality is not great, and then you have very wrinkly forehead, like if something's not in balance, your head, like your mind says something's wrong. Or if there's obvious signals, for example, you look very natural everywhere else and your lips are overfilled, that
Yeah.
immediately oh, that looks done, and they can't focus on anything else except that your overfilled lips.
Yeah. Yeah.
So it's all about proportion and harmony. And when something looks off, that immediately clocks that for the human eye, and you can't even explain it at that point what is done. Does that make sense?
That does make sense. Yeah, absolutely. And I think that's a really, really important topic. I know like in the past I've heard other physicians talk a lot about things like the golden ratio, that comes up a
Yeah.
lot in terms of like trying to understand the geometry of all of this and like and I get that, but I think for the average consumer that's really helpful to hear what you said because we don't really think about proportions, especially going back to what we were talking about. If you have a little bit of body dysmorphia going on, where you're kind of hyper fixated, I mean, 5 years down the line, you might be noticing that, like, oh, I overdid it, with my lips, or I overdid it with my nose. And this leads me to ask you, I recently I've seen a lot of this where surgeons and aesthetic providers, they're able to do a lot now with like fillers and injectables that can really kind of transform the anatomy of the face and just even like the optics of how things look. I mean, I'd love for you to kind of dive into that in terms of like, is there a safety difference or like a longevity of results different between like truly like non-invasive kind of treatments versus the more invasive full-blown surgery treatments? I mean, what's your take on that?
I think ultimately you have to think about surgery and non-surgical treatments as just tools in a toolkit, right?
Mhm.
You can't expect surgery, a facelift that restores laxity and restores tissue to where it's supposed to be, to also help with volume deficiency. Well, that's really either you're doing fat grafting or using fillers or whatnot. And you can't expect using fillers and fat grafting to replace volume to lift sagging tissue, right? So you have to use the appropriate tool for the problem at hand. I think the problem becomes when you think that you're going to use one tool to solve all of your problems. That's how you get overfilled faces. That's how you get, if you really are volume deficient and you're just trying to pull your face as tight as possible, you're still just going to look volume deficient.
Yeah.
So it's
Yeah.
really about, I think the aesthetic industry cannot be so segmented and saying, like, you can't have plastic surgeon says, facelift is the only thing that can solve all of your problems. You can do a great facelift, and the person has poor skin quality, it's not going to look right. You
Yeah.
can have, the best skin quality, but everything is a sagging, you have volume loss. Just doing skincare is not going to cut it either. I think the aesthetic community has to come together and not say, like, it's either surgery at 30 years old or, non-invasive stuff at 30 years old or whatnot, like whatever you want to pick, but say, like, look, we are all team members on this team so that we can make our patients present like the best self, and we have to work together. It's not one tool versus another. And I want to make one more point about this is that I think some of my happiest patients, they are happy before their surgery. And that's how I can tell that they're going to do well before surgery, because I'm very worried that we're going to enter an era when people are so hyper-fixated of looks maxing or whatever is it that they're doing to get to their ideal self. So they're constantly picking and picking and picking so they can optimize their looks. That is not good for your mental health. That is not the right attitude to go into any kind of aesthetics procedure or skincare.
No, that's a really, really good point. I'm glad you mentioned that. Yeah, looks maxing is everywhere right now. I don't know why we're so, and we keep pushing it. Like this is, it blows my mind. It's like social media keeps pushing it over and over again. And it's like we have to come to a place of society. I think I completely agree with you, where it's like there needs to be something, right? Like a barrier. I don't want to stop anybody from, doing what they love or they want to do. Like, and this was actually one of the questions I had for you. Like, for example, like the 28-year-olds that are like, I want to get a facelift. I feel like I need to get a facelift. And you look at them, right? And you're looking, and I'm like, what are you lifting? Like, you are fully lifted, my friend, like your face
Yes.
looks great. I mean, what are your thoughts on that? Like, because I feel like now more than ever, we see this younger generation that's just like ready to go. They're like, skip the
Yeah.
skincare. I'm ready to go see a surgeon. Like, I got to get something done. Like, what are your thoughts on that?
It all comes down to education, right? I
Yeah.
very naively at the very beginning of my career believes that you can have an unlimited number of facelifts. You cannot have an unlimited number of facelifts. Every time you touch the tissue, there's going to be scar that's formed. We are not in an era where you have scarless healing. The tissue, if you one thing has a weird tension line, you're going to look odd. When you're 20 and you have no laxity, it is the provider and the surgeon's responsibility. And I actually think it's malpractice if you say like, hey, yes, you can do a facelift when you have nothing to lift,
Yeah.
because it's your responsibility as a physician to do no harm at that point. Does that make sense?
Yes, yes. And I love that you said that. Yes, do no harm. And I also like it's like educate, right? Like you had talked about this earlier, is like just educate people, like that's, and I think a lot of times, like that's what I was trying to tell you earlier, where it was like when I was growing up, like you went to the doctor. You actually went to your doctor and said, I don't know what's going on, help me, and you allowed them to educate you and share information with you and things you didn't know about. I mean, this was like pre-Googling things and AIing everything, So I don't know. I worry about the youth a lot because I think that they get so sucked into this. Another thing I really want to ask you about this, as we know, clinical grade skincare is not a thing. Neither is medical
Mhm.
grade, neither is any of the other BS terminologies on the market. Do you think there's a difference if somebody gets an actual surgical procedure done, something like a facelift, and then
Mhm.
they are asking, like, if they're asking for skincare, like, what do I do to maintain my results? Or, like, just good skincare habits. Do you think there's a
Mhm.
difference when you look at the products that are on the market in terms of the categories they might sit in, hypothetical categories? Or do you think it's really, I mean, what is it that you would think is the main thing we should be looking at as consumers for like post-procedure care?
So I tell all of my patients this after facelift that we basically tucked everything back into where it's supposed to be, but you have to take care of your skin. And I really divide everything into four main categories: a
Mhm.
good cleanser. You need something that keeps your skin turning over, some kind of retinoid. You need some kind of antioxidant, and then a sunscreen. I don't like multi-step skincare because I think people cannot stick with it. If you cannot be consistent with your skincare, it doesn't matter if you have XYZ, the next greatest thing, if you don't use it, right? So if I can get a patient to put on sunscreen consistently every single day, it doesn't matter if it's sunny or cloudy outside, that they can wash their face and put on a retinoid and an antioxidant, I think you're 95% of the way there. Don't you
Yeah.
agree?
Yeah, I would agree. And that's really great. I'm glad you really simplified that because I love, like, I won't lie to you, I love all of the stuff we're doing in skincare. I love research, so I come from the
Yes.
research side and I always feel like, oh, this is so exciting. And it's exciting to see research being translated, right, in a meaningful space. But we do put the cart before the horse. And
Yes.
we do start making a ton of claims around skincare that are just simply not viable, at the time that we're making them. And I think a lot of times it really helps to have that clarity, what you just provided, because you can get so sucked in. Before you know it, you've spent $5,000 in a skincare routine that's like 10 steps. And it's like, you don't even know anymore what's working. Like, you
Yes.
know? So I think it's a really interesting area right now in that sense, especially as we approach like regenerative skincare, for example. There's so many products now on the market. So
No,
yeah.
I absolutely agree.
Yeah. From the side though, I do want to ask you about something because when it comes to like multi-skin routines, one of the biggest categories that stands out to me is K-beauty. And don't get me wrong, I love Korean beauty. I think it's one of the biggest drivers of innovation in skincare. I mean, I think the way Korea comes out with new ingredients and the you know what I mean, like the pace at which they're constantly coming out, I think there's a lot of like scientific vigor there, but it's
Yes.
also led to a lot of damage to people's barriers, I think, in some
Yes.
ways. Also, one of my big questions is I know overseas you can get like multiple procedures done in one session. What is your thought on that? Like, is that something we should even be doing? Or, I mean, what's the deal with that? People getting like 10 procedures in one sitting.
I think, with K beauty, like I have friends who go to Korea and then they send me a list and say, look, I got Kybella, neurotoxin, I got, soft wave, like salmon, like DNA, all injected all at once, and it's only like $20, you know?
Yeah.
So I'm really hesitant about stacking so many procedures at once. K Beauty, I think they have a lot of scientific rigor behind their skincare, especially their sunscreen. They have filters that we don't even have. They're years ahead in terms of sunscreen. But I think doing so much to your face, I kind of pause at that. And I'll share this story. I probably get in trouble for saying this, but I was at a conference and I was talking to a Korean dermatologist and I was like, man, this is years ago. This is probably like 10, 15 years ago. And I was like, man, like this, what do you think about the 20 step, like, you know, K beauty things? And she's like, yeah, like it may work, it may not work. But you know what? I think like everybody's just on microdosing Accutane. This was like years ago.
What?
I was like, oh,
Microdosing Accutane.
but
What?
like Accutane is a very well regulated drug in the United States. You can't just get access to it. But
Yeah.
I don't know if that's true or not. But that was just an offhanded remark that this
Yeah.
Korean dermatologist made, and I think but you have to think about some things like maybe there's okay, like there's I think it's really good to have a routine that's very meditative. It relaxes me to have like a 10-step skincare routine at the night, just to set the tone for bedtime or a bedtime routine. That's great.
Yeah.
But I think once you start making claims that all of these things is the reason why you have flawless skin. But like, is it those skincare ingredients or is it the microdosing Accutane?
That's right. That's right. No, I mean, I'm still laughing about the microdosing because I have to look into this now, by the way. Like, I need to figure out if microdosing Accutane works.
Does help 100%. It does help. The microdosing Accutane has been shown to improve collagen. It does help, but Accutane has lots of side effects, and it's not that easy to obtain in the United States.
No, but I mean, at the same time, though, like that's really fascinating to hear that because, yeah, like what's crazy? The other day I saw like someone's social media. I forget who the creator was, and I saw the post. It was a man, and he was like, "Yeah, so I went to Korea, and I got the 10 procedures done in one sitting," and he's like, "I still look the same." Like it was like 3 weeks later, and he's like, "I don't think my face changed at all. My friends think it did. I don't think it did at all." Like, and he had gone through. He's like. I didn't get any of the numbing done or anything for the PDRN injections or anything. And he was like squirming in pain. And it was like, I don't know why I did that to my body. Like I feel the same. So, I mean, that's why I asked you because I'm like, does it matter? Like, that you went and you got all these like different freaking injections and, whatever. I don't know. It's interesting. I'd love for somebody to do a few studies on this so we can get some data on, what's the skin quality like.
Well, I think the taking care of your skin is culturally so inherent in Korean culture. And that's, there's something to be said for that. I think when they're religious about staying outside of the sun. So
Yeah.
of course that helps, So if you look at, you don't have collagen breakdown from sun damage, and that's really important, So what percentage of it is it the snail mucin versus staying out of the sun?
Since I'm on this, I want to ask you about like a realistic aesthetic plan for people in the long term. Like, how do you think, like I myself am 39 years old, very excited to turn 40, and I've never actually gotten much done, and it's not because I look down on it or anything. I've just frankly I'm scared, and I've always had so many questions for my providers, and but the point is like I've never had a plan in place where it's
Yeah.
like, well, when I am ready, you know what I mean, to get
Yeah.
anything surgically done. I mean, what is something that you think is like a good guiding principle or a good guiding plan for people, maybe like myself, that are open to things, but we might not know where to begin and, where to like kind of prep ourselves before going in and seeing a professional.
So I think what's really important to keep in mind is that you want to preserve what you have right now. And so coming from that mindset, when you're in your 20s and your 30s, it should really be about skincare, right? Taking care of your skin, staying out of the sun, make sure you get sun protection and whatnot. You don't really need anything more than that. Your collagen is at its best, right? So
Yeah.
you don't need to like mess with it that much. As you get older, we lose collagen every single year. Then every single day you're losing collagen. So you can think about some things that protect the collagen in your skin, things like a bit of microneedling. But that's really pretty much all you need. If you start experiencing significant volume loss, that's when you can think about very strategically placed fillers, not to transform your face, but to replace the volume that you have lost. I don't think filler is as bad as everyone make it out to be. I think strategically well-placed fillers are great. And I also think it's very important not to do things that would damage the surgical plane if you want to have surgery in the future. So things that's like, really like cooking your face and, frying everything. Sometimes I hear some claims saying like, this is going to tighten your smaz. And I'm like, no, leave my smaz
Oh my
alone. I don't
God.
want
Yeah.
like anything like frying my smaz. I need that
We
to
need to
hold.
put that on a t-shirt. Leave my smaz alone.
Leave my smaz alone. Right,
Yeah.
exactly. But then, if you consistently maintain your skin, strategically place fillers when you need it, but nothing crazy, and then doing some microneedling to support your skin. If you have pigmentation issues, doing some BBL to help with the pigmentation, and then I don't think you need to do that much. And
Mhm.
by the time you need surgical intervention, which is for most people late 40s, early 50s to 60s decade, your skin, your face is not this hodgepodge of things that has happened to it. And then you're like going through a minefield as a surgeon so you can have a nice result. Does that make sense?
Yeah, yeah, no, that's really, really good advice too. I like that you brought up that we have to keep the surgical planes, free of all this like fibrosis and all of the different things that can result from like just, overdone stuff and, maybe even premature. Who knows? I mean, I think that's interesting that you're saying that because I've never been able to get a surgeon to tell us that, because this is the idea that I feel like if we put the information out there, like a plan, people will have something like a roadmap because I think sometimes people wake up in the morning and they're like, "Oh my God, I need to go get something done." Like I can't believe I've gotten nothing. And I know I've had that feeling myself, where it's like I gotta go see somebody. I gotta, and
Mhm.
to avoid that, I just feel like when you have something in your mind that's like a roadmap, like it avoids that like impulsive nature, that we often see in aesthetic medicine with patients. So that's really
Yeah.
helpful. So I'd love to actually kind of like go back to the philosophy of stuff a little bit with you because I think that there's a lot to learn here in terms of like beauty. You said you started the interview with explaining how you really love the idea of beauty. I mean, what do you think in today's age, right? What do you think contributes the most to like our perception of what beauty is and how do you analyze that maybe in your patients or even just in general, knowing what you have so much knowledge, from the aesthetic side. So looking through that lens, when you look at beauty at large, what are some things that really stand out to you as driving forces behind that concept?
You know, um, for me, this is maybe a little counterintuitive because I'm in plastic surgery and I am a plastic surgeon, but I actually think some of the most beautiful people that I see, they have a true internal radiance. And it has nothing to do with what's on the outside. And I believe that 100%. They're smiling. And I actually think when you're smiling, that's the best mid-face lift you can get than like any other mid-face.
That's right. That's right. I love that. Yeah.
So, I'm naturally a very happy person. So I love being around people who are happy, who are radiant, and I think that's the foundation of beauty for people who are not picking themselves apart, but accept themselves at whichever age they're at. Now, sometimes I have patients who say they're happy people, but say, when I look in the mirror, I don't even recognize myself. I feel so much older, I look tired, and people always think I am angry, like, like everything is sagging, but I don't feel that way inside. I think when you match what you feel on the inside with the outside, and everything's in harmony, and you're not doing all these crazy things trying to transform yourself, I think that's when true beauty shines through.
Yeah, I love that. I love that. And I'm so glad you said the happiness part because I think we really all just need to be happier, And I know it can be tough. It can be tough. We're going through a lot right now, with the economy and a lot of things, but I love that you said that, I don't see a lot of people smiling like all the time. It's like, just like I think like when we were growing up, people said that, right? It's like smile more. Like it's actually,
Yeah.
it's really good for your face to smile a lot. And I don't know. I wish we'd hear that more often, for everybody. It's just, just be happy. That kind of
Well,
thing.
I mean, like it's a very, I mean, like it's almost like I reduced to something so simple, but at the same time, there's a lot of things that we have to be. I mean, there's a lot of assault in the world right now on our psyche and everything. But at the same time, there's so much beauty around us in terms of our community, in terms of aesthetic experiences. And I think also being kind to yourself and not picking yourself apart, and a constant chase of perfection is not it. And that's actually going to distort you more than anything else.
Yeah, no, I absolutely agree with you. And I also like there's just so much like comparison now too. Like that's a
Yes.
big component of it. I feel like I just wish people like I mean I'm guilty of this. I'm not trying to like talk at anybody, but it's like put our phones down, and just be like be present for a minute, And I think a lot of times I've done that a lot and I'm just like it'll shock you how much happier you feel. Like it shocked me, when I stopped like looking at social media, I think at this point I don't even really look at it like that. It really shocked me because sometimes like I feel like we're internally comparing ourselves even though we don't realize we're doing it. So we're scrolling and we're looking at whatever and we're like, "Oh, I need that." And I think a lot of times like that's been such a driver I feel like with plastic surgery especially is that sometimes you look at somebody else, like you look at a celebrity that got a boob job, and you're like, "I need my breasts to look exactly like that." And it's like, how do you know that? How do you know? You're comparing apples to oranges. I mean, no pun intended, but you know what I mean? Like you're like you don't know what's going to look good on your body. That's my point. So I think people need to like take a step back, and just think.
Yeah, and
Yeah.
but I am very optimistic because I think I think the current generation of people are very smart, and then they understand like what's a filter, and like this is not realistic, like normal skin doesn't look like that. And then there are a lot of creators who point that out and say like like this transformation, like it's because of the lighting and one, so people understand that these are unrealistic expectations that's put out there. So I am very hopeful in that way. And I think we are approaching, an era where patients are very well educated. When I see patients coming into my office, they're not a blank canvas of like, oh, I don't know anything. They know a lot of things. And that's really good. I think it holds the professional community accountable, and it's good to, democratize information.
I agree. No, I completely agree. Now, I do have one like random question for you, and I'd love to get your take on this. Is like, I feel like doctors get criticized a lot. We get a lot of critique for like accepting brand deals or accepting like, you know what I mean, like anything from the even celebrities. Like, I'm sure you've had a lot of celebrity clients and stuff, and we get dragged, I feel like, on the internet. Like, what is your take on that? Because like, I just feel like if you've gone to school for 20, 30 years, like you have every freaking, right to be like, if I want to take a brand deal, I'm going to take a freaking brand deal. I mean, what are your thoughts on that?
Well, my thoughts like you have to take the brand deal that you truly believe in, not just for
Yeah.
the money, right? So
Yep.
I actually think doctors should be very present in the conversation in social media, like the things that, like you do, because if we're not the voice of reason and science and evidence-backed evidence, that vacuum is going to be filled with misinformation, and
Yes.
we cannot, and that hurts public safety. And, in terms of brand deals, I think you can take brand deals if you really believe in the product, but not just some, XYZ skincare cream that you're trying to sell.
Yeah, no, that makes a lot of sense. I agree with you. I think that's, but that's the thing is like, I feel like a lot of doctors do that too. And it's like, I asked you because I recently saw a lot of critique about this online. It kind of like irked me because I'm like, I knew the doctor, right? Like in this specific scenario, I was like, I know that person. I've interviewed them, but he's brilliant. You know what I mean? And I feel like the product he chose is also brilliant, but it's like you get dragged and practitioners nowadays, I feel like I mean, it's good to hold doctors to high regards. You know what I mean? You do have to hold us accountable, but
Yeah.
it's like, just go easy, man. Like you're seeing influencers, you see influencers, right? With like 2 million followers, and they're out here like selling you garbage. Like it's not even like science? So
Yeah.
if you see a doctor, like maybe just pause for a minute and be like, why do you think they picked that brand deal?
Yes,
Like
for
that kind of
sure.
thing. So.
I agree.
No, but just to close out, I'd love to get your words of wisdom for anybody who's listening that maybe has a child or is somebody looking to go into medicine. Like, just some words of wisdom on like what it takes to get to the point, like your career. You've done so much, you've accomplished so much. Like, what do you think it really takes to get to that point in your career and maybe just a guiding light for anybody that might be interested in medicine?
When I look back, I see that my journey to medicine is not linear, and then people go into medicine for all kinds of reasons. But ultimately, you have to be authentic to yourself, right? I've always been obsessed and loved beauty and anything that's a beautiful experience. And in medicine, I still found that. And in medicine, it's hard. It's a long journey. It was 4 years of medical school, 6 years of residency, 1 year of fellowship. That's 11 years of your life that you give up so many holidays, events, because that's the sacrifice that's needed. But we're designed to do hard things. And there's so many aspects to medicine that you can find whatever that fills your satisfaction and what drives you and your desires. So I think you have to love the field. It's not, originally I went into medicine because I'm like, oh, it's practical. Like, I can get a paycheck. So, I'm not a starving artist.
Yeah.
But to really succeed, you have to love it. I love plastic surgery. This is like, I feel like this was my calling at the end of the day, even though I went about it in a very roundabout way.
Yeah, no, I love that. That's great advice, and thank you so much for that. And I really hope I love seeing people get curious about medicine. That's why I asked you because I see a lot of youth on social media, and they're like, oh, what did it take and whatnot. So I love getting this kind of advice from professionals just to help them out. But thank you so much. That was amazing. Um,
Thank you so much. It was really fun talking to you.
I love this conversation. And for everyone tuning in, if you guys have any questions about aesthetics, please chime in, let us know. Maybe we can have Dr. Lee come back for a part two if she has time and answer some questions. But this has been wonderful.
Thank you.